Have you been left waiting on care that felt like it would never appear? Healthcare workers are leaving the public system for high-paying private roles, worsening shortages. You deserve more than nurses and doctors who are drawn away at a public system that's been left in the dust. Investing in retention strategies like fair wages, better staffing ratios, and full-time opportunities can help stabilize the public workforce. What a beautiful solution. And you know what would make it doctor approved? Properly enforcing the Canada Health Act. That's right, it's time to give our public system a legal booster shot. When we actually check the pulse of our policies and keep private profiteers in the waiting room, care stays where it belongs, in public hands. Because the prescription for a healthy nation isn't privatization, it's participation. Let's fund fairness and not fortune, and keep the Canada Health Act doing what it does best, keeping healthcare in good condition.
Are you tired of losing critically ill patients due to long hospital wait times?
Hey, I'm still breathing.
Darn, we lost another one. What is that, 100 today?
101. Don't forget we lost Janet this morning.
Oh, bummer. But wait, for the low, low price of proper enforcement of the Canada Health Act, you too can be an owner of a hospital system with reasonable wait times. But wait, if you call now, we're going to double you that offer. We're going to give you reasonable wait times and adequately staffed hospitals. All you have to do right now is pay for shipping and handling.
Wow, Billy, that's great.
Right? It's so great your dog will want one too. Long wait times? Not anymore. Uncle Billy's got your back. We're going to improve scheduling, positions, put money into retention programs so folks like you can get your x-rays in a timely fashion. It's time to recenter healthcare rights on social policy and collective responsibility.
Ever wonder where your healthcare dollars really go? When care becomes a commodity, efficiency takes a plunge, and so do your tax dollars. Public good? More like private drain. Suddenly your hard-earned money is circling the profit pool while patients are left treading water. Private clinics skim the cream, public hospitals scrape the barrel, and somehow the bills keep growing. It's like paying for a full-body checkup and only getting a paper cut covered. The house always wins, and spoiler alert, it's not your house.
Hi everyone, Billy Mays here, and I want to introduce you to our newest and improved Canada Health Act. Unlike our competitors here, look at this patient care, and look at this mess. Take a look at this, falling apart, always cutting corners, classic privatization. Well, look at this. With Billy's new and improved Canada Health Act, we have 3 times the absorbency power. Look at that, folks. Look at that. And the table is dry. With our new and improved Canada Health Act, that requires public reporting of any private contracts for universality and transparency. Our new and improved Canada Health Act is strong enough to hold up 5 million Albertans. Oh, that is strong, folks. Act now, folks. It's time to supercharge your health care. And if you call in the next 5 minutes, we'll throw in an amendment so private care can't bundle services. It's so good, folks, the federal government should want it too. This product is going to expand the capacity in public health care settings, extended operating hours, so folks like you can come and get your diagnostic exams in a reasonable time. Don't wait, folks. Pick up that phone and call and get that free amendment valued at $19.84. Huh, 1984. Wasn't that the year the Canada Health Act was enacted? What a coincidence. But wait, if you call now, we'll throw in a bottle of equity. Absolutely free. And folks, that price is priceless.
The proper enforcement of the Canada Health Act is critical to a true public healthcare system. With the upgrades included in this product, Section 18 of the Act will ensure the prevention of the bundling of insured and additional services, as well as public reporting for increased transparency.
Are you tired of semi-privatized hospital care systems undermining equity, accessibility, and creating barriers? Well, this neoliberal policy framework is damaging to patient care. You know what Billy says to that? Well, bam! Hi folks, Billy here again, and I'm so excited to share with you my newest product. Introducing MightyCare. This putty, all you have to do is work it into your fingers like so, and bam! It's gonna piece together pieces of a complex system, just like that. This nifty gadget helps improve service delivery by prioritizing coordination that shares data across all systems. Apply, touch, and mend it. This product is not available in stores. Order now, and you folks will get it in time for Christmas. The whole gang's gonna love it.
We have a vision for healthcare in Alberta, one that goes beyond patchwork policies and fragmented systems. Let's start talking about repealing the current legislation that has divided our healthcare framework. We can rebuild a cohesive and integrated system that's truly supportive to the equitable provision of care for all Albertans, in line with an anti-oppressive approach by rebuilding integrated healthcare governance, prioritizing coordination, and sharing data across the healthcare system. Let's create a more efficient system built for all Albertans.
Long live healthcare. You can't put a price on healthcare, folks, can you? Wow, that's really good. The longer you set it, the better it works. Call now, folks. This isn't available in stores. We're here to save you money. Uncle Billy wants to save you money.
Hello.
Can I help you?
I'm good, thanks. I'm here to check in.
It's $2.75 for the check-in.
$2.75? I don't even have that much.
Can't help you.
Well, I guess I can put it on my card, but I wasn't supposed to use it.
Well, so you got the deposit down to $2.75. Afterwards, you're going to be paying the nursing fee, the bed fee, the IV fee, and it's also $1 per footstep. So
Per footstep?
that's how the things work around here.
That's outrageous.
Whoa, 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 whoa,
Next.
whoa, whoa, whoa. Put down that money, because we got to talk about healthcare in Canada. Now I'm hearing people say, hey, maybe healthcare should be more like a business. Faster, flashier, pay for what you get. And I'm like, whoa, whoa, whoa. Are you kidding me? You don't buy Canadian healthcare, you live it. It's part of who we are. Let me tell you, back in the day when we built our healthcare system, we weren't selling a product, we were building an identity. That's right, Canadianism. Sounds fancy, right? But it's simple. It's the idea that your neighbor's well-being matters just as much as your own. You get sick, you get care. No contracts, no gimmicks, no platinum plus health tier, just plain, simple care. Now look, I get it. People say the system's slow, under pressure, lines are long. You're thinking, Vince, we need innovation. But sure, but privatization, that's not innovation, that's imitation. Copying the worst parts of a business model and calling it efficiency. When you let healthcare go private, you're not just changing how we deliver care, you're changing who we are. The welfare state wasn't built to make billionaires richer. It was built to make citizens healthier. And listen, folks, when one person buys their way to the front of the line, 10 people fall behind. That's not efficiency, that's inequality. You wouldn't buy half a ShamWow and expect it to work, right? Well, you can't expect to half fund a healthcare system and have it shine. See, Our healthcare system is like the nation's greatest life hack, collective responsibility. It's efficient, it's fair, and it's the reason we can all say, hey, I'm Canadian, and my well-being isn't up for sale. Now, I'm not saying we can't get better. Oh, we can. We can reinvest, re-energize, and recommit. But what we can't do is hand over the keys to the folks who see health as a market opportunity. No way. Because policy growth shouldn't mean growing profits. It should mean growing fairness, growing access, growing that sense of us. That's what the welfare state is all about. It's not nostalgia, it's national character. So next time someone says, hey, want to buy a piece of the healthcare pie? You tell them, sorry pal, this pie's for everyone. That's the beauty of Canadianism, baby. It's not all about a word, it's about a way of thinking. You're saying no to pay to play, and yes to care for all. So let's keep it public, keep it fair, keep it for everyone, because you can't buy well-being, but together, we can build it. And remember, act now. And by now, I mean every day. You can protect the deal of a lifetime. Healthcare for all Canadians. No hidden fees, no fine print, just dignity, equity, and care that works. So what are you waiting for? Let's slapshot privatization right out of the conversation, because when we stand together, everybody wins.
Call now, because your wallet shouldn't decide if you live or if you die.
Vince Offer, back again. You got problems. You got a system taking money first and putting your healthcare last. It's time for a solution. You don't need fancy gizmos, you need this, a structural social work lens. Buy it now, I'll throw in a new and improved healthcare policy. What's it got? It's got fee caps. What else has it got? It's got transparent pricing. Bam. It's even got billing guidelines like in dental care. Bam. Google that, don't Google me. This handy tool is going to reorient healthcare lenses towards fairness, accountability, all that good stuff. Your mom is going to have it. Your friend is going to have it. Better yet, you're going to have it. Want more? I'll throw in human rights and the new healthcare policy in one. Don't miss that number. Don't miss that deal. Folks, Billy and I have shown you the cracks in the system, the overpriced nonsense, the privatization gimmicks. But now it's time to talk about why it's all happening. That's right, this isn't a coincidence, it's political economy theory, baby. Let me break it down for you. When you see hospitals struggling, workers burning out, and patients waiting hours just to be seen, that's not random. That's intentional policy at work. You see, the same folks who want to fund the public system are the ones selling you faster care through the back door. Classic move. Break it, blame it, and then sell it back to you at a markup. Political economy theory tells us that these decisions, the budget cuts, the efficiency reviews, the endless talk of consumer choice, they're not neutral. They're part of a neoliberal playbook that says, public bad, private good. And just like a bad late-night product, it looks shiny at first until you realize you're paying monthly for something that used to be free. You can't fix a public system with private logic, folks. You wouldn't fix your car by selling off the steering wheel. But don't worry, because I'll break it down even more. That's a 3-for-1 deal you can't afford to miss. Political economy theory exposes the hidden costs of privatization faster than you can say user fees. Just apply a small amount of critical thinking, and bam, you'll see how inequality and austerity are part of the same product line. It's the perfect tool for spotting structural injustice in any policy package. So if you call now, you'll also get our Structural Social Work Starter Kit. Are you tired of being told individual effort can fix systemic issues? Wish someone would finally look upstream? Well, look no further. With the Structural Social Work Starter Kit, you won't just treat symptoms, you'll challenge the causes. It recenters responsibility where it belongs, on governments, institutions, and policymakers, and it comes fully loaded with collective advocacy, critical reflection, and a lifetime guarantee of solidarity. Use it anywhere. Healthcare, housing, education, even your next political debate. Works on any kind of inequality, guaranteed. Guess what else? You're going to love my anti-oppressive practice. That's right. The anti-oppressive practice add-on ensures your care lens includes marginalized voices, lived experiences, and social justice. It dismantles bias, checks power, and empowers communities to lead the change. Its intersectionality meets action, and it's rechargeable through reflection and accountability. With anti-oppressive practice, you're not just resisting the oppression, you're redesigning the system so it can't come back.
It's time to recenter healthcare policy on social rights and collective responsibility. Our products are Mother Nature approved. Good for the environment, equity, and social justice.
Now you're probably thinking, Vince, this all sounds amazing, but how much does it cost? Well, brace yourself, because the price tag is $0 up front. That's right, All it takes is political courage, public reinvestment, and a dash of social solidarity. And if you act right now, we'll even throw in a bonus offer. The Canada Health Act Reinforcement Package. With Section 18 power, anti-bundling technology, and transparency upgrades, it keeps your healthcare system leak-free and your values intact. And, for a limited time, we're also giving you the MightyCare product to put the system back together. New healthcare policy to keep those services accessible, and the staff retention package to keep experienced staff in public care where they belong. That's thousands in value, all completely free. But let's be real for a second. These theories and products aren't just fancy academic words. They're a blueprint for justice. Political economy theory shows us who profits. Structural social work theory shows how power operates. Anti-oppressive practice shows us how to push back. Together, they rebuild the system from the inside out. And that, my friends, is a deal worth protecting. Because every time we let profit drive care, someone's dignity ends up in the clearance bin. And I don't know about you, but I like my rights full price and publicly funded. So don't hesitate. Call that number on your screen right now. Buy it online with your credit card. Or mail your complaints to the government of Alberta.
Long live your health. All you have to do is call now. Call that number on the screen, folks. Do it for your family.
Social Work 4416, students not responsible for any damages caused. Batteries not included, competent government sold separately. Comments about Billy's eyebrow tape not accepted. Comments about Vince offers criminal past are encouraged but are not endorsed by the MightyCare team. MightyCare is not responsible for any emotional damage caused by viewing this project. Warning, this project may cause you to receive an A+. Do not ingest MightyCare or any Canada Health Act related products. If you do ingest products, call a public doctor.
Hello.
You're going in the post-credits scene, Leslie.
Doing this for you, Leslie.
Well, thank you.
Day 3, filming the Billy Mays Witch Project.
Go Billy!
I have another idea.
Billy may have another idea.
I'm supposed to go in 5 minutes. I'm going to go in 10 minutes.
Come on, Charlie.
That's great.
Yeah, just go back to... Yeah.
Hey, it's me, Billy. It's me, Billy Mays.
I don't think Billy's ever talked like that. Metamot with Billy Mays. You thought he died in 2009, but here he is.
All that's left.
Yeah, Andrea died.
Yeah.
Amon died.
We killed Bobby.
Well,
Bobby, Billy.
Billy.
Bobby did our time. That does not go on.
Oh, great. Love this life. Love this project. 10 out of 10. Video diary?
And then try louder.
What do you want from me?
This is a real close-up of. Aww, I'm holding a camera. But theoretically, this is the last thing we'll film for this project. How do you feel, gang?
I don't want to be here Tuesday.
Yeah. Sunday filming. We're on the elevator. We're gonna go film. Okay. And we got the team. It's for the credits team. Say hi.
Woo!
No idea. Ooh, I'm the clock man. Put that in the post credits.
Oh, God, look at this mess. Privatization. 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 Yeah! Gross. Do people actually use this stuff? This is horrible. This is horrible. Bam! Bam! Bam!